There's no 9 lifted.
They fly in some of the UK's most dramatic landscapes.
OK, the weather's starting to close in. I'm worried I can't get over the ridge. My escape option at the moment is to go up.
From high-rise city centres...
It's going to be bumpy, it's going to be turbulent, guys.
...to remote peaks battered by extreme weather.
The top looks to be in cloud. Can you confirm that's the case, over?
The crews of Yorkshire's 2 air ambulances risk their lives...
Gone unresponsive.
It's just gone unresponsive on us.
...to save yours.
There's potentially fatalities involved.
That car's a right mess.
Delivering intensive care by air.
It's not safe.
There's a lot of blood there. There's a lot of blood there.
No matter how critical the case.
This is the first time anything like this has ever happened.
We're circling a house fire.
However risky the place.
I'm going to get down there quickly.
He's got an almost complete amputation at the right knee.
You're having a heart attack, okay? The heart is blocked.
Let's get loaded and go.
Going to extraordinary lengths.
Here it is from Medic 2 at the patient's side, however.
With humour.
You might get rest at week off if you're lucky.
What is it, Thursday?
Yeah.
And compassion.
OK, chick, we're just going to get you out, all right? Don't worry, we'll look after you, I promise.
This time on Helicopter ER.
Very agitated. He's not really communicating much.
The team fight to save the life of a motorcyclist who's come off his bike on a bend in the road.
He's not awake in a normal way, which suggests he may well have a brain injury.
An elderly farmer is in agony after being trampled by one of his cows.
Apparently threw him into the air, so we were a little bit concerned about his leg and his abdomen.
And a mountain biker is seriously injured when a trail jump goes wrong.
It's the ribs that are hurting.
It's your ribs that are hurting.
Yeah. Spreaders lights, yeah, they're good. Autopilot's trim, engage and steering in. Back to the east.
It's a bright Saturday afternoon at Yorkshire's Air Ambulance headquarters, and Helibed 99 is preparing for takeoff. In South Yorkshire, a motorcyclist is lying critically injured after coming off his bike. Paramedics Steve, Pete, and Dr. Neil are a 7-minute flight away.
Go ahead.
Yeah, just a quick update on this patient. The patient was unconscious. He has blood coming out of his mouth. He is actually coming round now. But he sounds like he's really confused. He's trying to get up. So that's all we've got at the minute.
If he's agitated and trying to get up, it can indicate a brain injury, so he may need an anaesthetic.
It was undoubtedly a serious incident that we were heading to. This was an unconscious motorcyclist with a very high probability of having a significant brain injury. The modern protective equipment, helmets, leathers, the hump, proper motorcycle boots can be really protective, but even if you're wearing full protective equipment, you can still be really seriously injured.
The team have a rough location on a country road near the former mining town of Maltby.
There's a circle of a restricted area right now from where the job is. So just to the right of it there, just underneath, there's like a quarry area. It says, oh, it's mine, it says on it.
Explosive.
Steve is using sat-nav to scope out the landing site, and it could be tricky.
So it looks right on a bend, Jeff. Fields either side.
Yeah, the report where he's riding with his mate, and I think he's gone round bend, looked in his mirror and he wasn't there, so he's gone back and found him in head.
Oh, right, OK. So that's that quarry here, isn't it? Is that the bend there? Just below us, on the right-hand side, aren't it? Look.
Yeah, visual.
We'll go in that field right in front of the ambulance then, mate. So we'll go over the top of the trees, the high trees. No, we're in the overhead. Got a spot to land over.
Roger.
Pilot Jeff can land his medical team within yards of the biker.
No, that's us landed.
Local paramedics are tending to him.
Hello. How are we doing? From the observations that I can see, he's got obvious facial trauma and he's very agitated.
Doing good.
He's not really communicating much.
All right, Stuart, all right.
Gosh, there you go.
39-year-old Stuart Sanderson was riding his sports bike when he came off on a bend in the road.
He's not done any communication at all.
No, he doesn't look right, does he?
No, doesn't look
One sec, scoop trolley and we'll have another look.
Stuart's biking friend raised the alarm.
When you found him, what was he like?
So we both come off of the roundabout, both come this way. I looked in the mirror, seen a cloud of dust, come round, he were in the storm, watch on his side.
Right.
Come on, Stu, mate. Feels
Open your mouth, fella. Let's have a look inside. OK, I know. OK, right.
Stuart is becoming agitated and combative.
It can be really challenging to assess somebody who's moving and sort of fighting and resisting what it is you're trying to do to help them.
Come on, Stuart, mate.
He was very agitated, moving his limbs in a not normal way, which in those first few seconds of assessment says to me that this chap's got a really bad brain injury. The hips feel all right.
Yeah, I've been able to straighten leg raise throughout.
His symphysis is aligned. Do you guys want to do the...
Yeah.
Don't worry about a collar, scoop straps over there. If he's looking difficult, I'll give him a bit of ketamine. I'll go and draw some drugs up.
Stuart was wearing a good quality helmet, but Dr. Neil thinks he has a brain injury so serious he'll need to be placed into a medically induced coma, a procedure called an RSI.
His respiratory pattern doesn't look normal. His trajectory is actually getting a bit better, but I think you're right, he needs to go to sleep. So we'll have a MAC4 and an 8-tube and a bougie, I think, almost certainly. And I said I'd give him some ketamine if they're struggling to bring him over. So this gentleman has come off his motorbike at some speed on this bend and has landed in that very large, prickly gorse bush. He was wearing a helmet, but the speed and the impact means that he was unconscious. He's actually improving a little bit, so he's a bit more awake, but he's not awake in a normal way, which suggests he may well have a brain injury. So Pete and I are just setting up for a pre-hospital anaesthetic, so we're just going through all the kit and the drugs and waiting for the crew to bring him over to us. And we've orientated ourselves sensibly so that we're relatively protected with the RRV behind us from traffic, and the sun is behind me. Yeah.
But in his agitated state, Stuart is now fighting the efforts to help him.
I'll just give him 20 for now. We'll see how that goes. Steve, you're in charge. I've given him some sedation.
Yeah.
Pete, I'll have a bag and mask on the circuit first, if that's all right. And a nasal cannula. I need another cylinder.
To save his life, they need to anaesthetise Stuart quickly. This is a procedure normally performed in an operating theatre. Today, it's on a stretcher at the roadside.
So head to me, please. We have it on Pete's side, if that's all right. Thank you very much. Right, can somebody sort out removing the rest of his leathers, please? Just going to have the bag and mask, please, Pete, with the oxygen turned on. Thank you.
O2's on there.
Can I borrow you, Brother Ambulance? Can you come and start putting some monitoring on, please? Thank you.
Stuart's damaged brain is causing a violent seizure. The team have no option but to carry on.
Thank you.
Moved at the bottom.
Can somebody just sort me out a little bit? My dad's, actually. Thank you.
How much Midas do you want?
I'll give him a couple of milligrams and we'll see how we go.
It's a symptom of bleeding in the brain.
Oh, he's stopped now, isn't he? So,
Yeah.
so just hold on for a second.
Yeah, stopped it. That's it.
Pete, can I have the suction?
Dr. Neil is clearing Stuart's airways. The team are preparing to sedate him and take over his breathing.
Pete, I can't manage this chap's airway like this. I'm just going to give him the drugs now.
Cannula in the
Right, OK, bring it up to me. He's going to have the drugs now and he's going to sleep very soon. Pete, are you happy?
Yeah, I think we need to.
OK, are you happy with the kit?
Yeah.
Cool, that's fine, thank you.
Once the drugs take hold, Stuart's lungs will stop working for themselves.
A minute from there, Neil.
Right, the rock is in. Pass me the orange airway, please, Pete.
I'll time a minute from there.
Thank you.
Dr. Neil needs to access Stuart's windpipe.
Are we cycling on the blood pressure, Pete?
CO2 is 5.1.
Can you take my glasses off, please? Tube, please, Pete.
He's carefully passing a breathing tube directly into Stuart's lungs. There's no time for error.
That's 25. That's quite long, but he's a long chap. 25 centimetres at the cords. Cuff can go up, Pete. There's the pilot balloon.
The breathing tube is attached to the airbag. Dr. Neil has now taken over Stuart's breathing.
Chest is going up and down. I've got CO2 and it's high. Sats are 99. Heart rate's fine. And you've got a radial?
Yeah.
Lovely. Thank you very much. Glasses back on. Thank you very much.
It's a success.
Turn the oxygen off on there. Thank you.
This procedure is proven to save lives in patients with traumatic brain injuries. But Stuart isn't out of the woods yet.
Right, guys, I think we're going to hospital in the helicopter, so if we can get him strapped properly onto the scoop, and let's go. Can you do me a favour, just squeeze the bag while I set up the vent when Pete's tidying? Thank you. His CO2 is really high, so if you can hyperventilate him a bit while I've set the vent up.
He's being hooked up to a ventilator, which will regulate his breathing on the way to the nearest major trauma centre.
So someone listen to his chest for me as well. So the ventilator's on, that should be working.
Got bilateral entry.
I'm wondering whether we just drive to Northern. What drive time?
Yeah, about 20
Yeah,
minutes.
25.
I'm happy to go either, Pete. You decide and I'll do what you tell me.
Want to walk through where we...
Yeah, I think DCA is going to be the best option. Yeah, this from Medic 2. Yeah, just looking at configuration at scene here. We're going to go by DCA.
Pete, he's had 2 of my dads and I'm going to give him a bit more fent for sedation.
Stuart's condition is critical. He could rapidly deteriorate at any moment. A flight would be quicker, but travelling by road ambulance means it's easier to stop and resuscitate him if necessary.
Can we look to be moving?
So 145, 93, 99, and his CO2 is coming down. We've done a rapid anaesthetic, which means that he's asleep. We can control his breathing, but also we can control his seizure activity, so he shouldn't be seizing now, and we can take him in a safe fashion to the nearest major trauma centre, which is the Northern.
So we've got that running through. He's had his sedation, anaesthetic. The TXA, when that goes in, I can't think of anything else. BP's been maintaining well, hasn't it?
Delivering a roadside anaesthetic can be a really high-pressured situation, but as a HEMS team, we work hard to train and prepare for that set of circumstances because it's not uncommon. And it is about bringing a sense of calm to what could otherwise be a very pressured and difficult procedure.
Happy? Yeah, I am happy.
How long did we decide to the Northern?
About 25.
25, OK.
Stuart was on his first ride of the year before he came off and suffered catastrophic head injuries.
So you're doing TXA and I will do pre-alert.
So, still pretty high on the CO2.
Dr. Neil and Pete will go to hospital with him. They've saved his life at the roadside today, but his injuries may yet prove to be unsurvivable.
TXA.
Yep.
He is 25 minutes away from the hospital care he desperately needs. The team will do all they can to keep him alive on the journey.
Nostalgia desk. Hi.
At Air Ambulance HQ, Paramedic Lisa's working as a dispatcher today.
Did you listen to it?
She's monitoring live updates on ongoing emergencies and deciding whether they trigger the major trauma category when she'll scramble the helicopter.
So this 85-year-old is being thrown up in the air, somersaulted, tossed back down, his legs bent wrong way.
It sounds like this patient needs help from the Air Ambulance team.
Half an hour away. Might set you off on it. Just, I know you're a long way away, but they're a long way away as well.
50 miles away near Hull, an elderly farmer has been charged by one of his cows.
Just to let you know, there's a second call for this. Patient's now unconscious.
Paramedics Gemma and Andy are on the case.
Hey, Lester, I got your last update, he's unconscious. We've got a 2 minutes to run.
We go to quite a lot of incidents involving cows, and this patient was 80 years old and he'd been thrown in the air by a cow, so we knew that the patient's injuries were definitely going to be serious.
In just over 20 minutes, Pilot Lee has his medical team over the scene. He's looking for a landing site that won't spook any loose cows.
I've explained that the aircraft is coming and for safety, but they've just said, can you land in another field instead?
Is this the same cow that actually caused the damage?
Yeah, but apparently they've got 4 people surrounding it in the top corner of the field, so they feel it won't be a threat.
Yeah, no worries, mate, thank you.
81-year-old farmer Jack Clappison is in a bad way.
Jack, can I have a listen to your chest? Is that all right? Have you got any pain in your chest? No. Nothing at all. I'm just going to lift your jumper up, Jack. Yeah?
Jack was doing pregnancy tests on his cows when one of them, weighing almost a ton, charged at him.
Do you remember straight after, Jack? Yeah. Yeah, so you didn't knock yourself out? Any pain there? No. Nothing. We're going to put a needle in your hand and give you some pain relief. If anything hurts on your chest, tell me.
He's got a femur/knee injury there. You can see hematoma.
Cow attacks are lethal. On average, they kill 5 people every year in the UK.
Are you able to wiggle your toes, Jack? Yeah, that's good, mate.
I know, Jack, we're sorting it out. I know.
Jack's leg is broken and he's becoming increasingly distressed.
Jack, it just takes a minute for us to sort this pain relief out, and then it will be really good and that pain will go away.
David was helping out on the farm when it happened.
It didn't even lash out, it just sort of walked towards him and it caught him unawares, really, and, you know, obviously given his age, he's slow to react. He fell to the floor and I just sort of ran over to him straight away and just started to reassure him, and Rob and Andy and everybody was on the phones to you guys.
Jack, we are, Jack. We're sorting it out. Just bear with us 2 minutes, sir, all right? It looks compromised, doesn't it?
Yeah, it does.
One of the most difficult parts of the job is treating patients in pain. And it's really, really important that we try and calm that patient down to enable us to gain IV access and to give them the pain relief that they so desperately need.
Jack's leg is swelling and his foot is very pale. The fractured bones may have severed vital blood vessels.
I'll draw some ketamine up.
I want the bloody legs in. Jack, try and keep this arm still, because we need to try and get a little needle into the back of your arm. Just lie nice and still, sharp scratch.
That's the least of your worries, isn't it?
We're just going to sort it out, Jack.
So you're going to have quite a bit of pain relief going in a minute, Jack, all right? And you might feel a bit funny when we give you it.
I feel bloody funny now.
All right. It's going to go tighten your arm, mate.
Paramedic Andy is administering ketamine. It's a powerful, swift-acting drug, originally developed as a horse tranquilizer.
Open your eyes, Jack, for me. Good lad. Hello.
So he's got a BP of 104/59, which is post-ketamine, isn't it? And then I still haven't got a pulse rate, but it felt relatively steady.
Yeah, it did.
Andy's searching for a pulse in Jack's broken leg. If blood isn't flowing, the tissues will die and he could lose his foot.
I can feel that all the way down, so it's just that, isn't it?
And he's got reasonable circulation here, hasn't he? So I think this might be definitely felt a distal pulse.
You can. Okay.
There is a pulse, but it's dangerously weak. To prevent the bones moving and causing any further damage, they're immobilizing the leg with a vacuum splint. But even with the ketamine, it's painful.
Sorry, buddy. That's it. He is wincing a bit. It's any time that leg's touched, that's his fracture site.
Farmers in Yorkshire are tough. I've dealt with quite a lot of them over the years, and they are really stoic. They don't involve us until they absolutely have to, and when they do involve us, you know they're in trouble. All right, Jack. Good lad. Having a little sleep.
Jack needs hospital care. The team are rolling him onto a scoop stretcher to take him to the helicopter.
Ready, steady, roll. Let's get that.
The stretcher will just need to go up towards Gemma a touch as well.
Jack was working on his farm and got attacked by a cow. I don't know what had caused the animal to be angry, but it definitely was. And it apparently threw him into the air. Jack's 81, so obviously an impact of that at his age can be quite significant. So we were a little bit concerned about his leg and his abdomen. So we're going to take him to Hull. OK, we're going to go and move. Ready, brace, move. Can somebody bring my pack of drugs and all those syringes, please? OK, so just big lift up and then push in. OK, keep going, keep going, keep going. Stop there, that's fine.
How are you doing? How are you doing? How are you doing?
We're just strapping you into the helicopter, Jack, for the trip to hospital. All right, buddy? Jack, just give me your arm and we'll get you a bit more of a painkiller. All right, mate.
As far as we can tell, it's just a knee and possibly femur fracture. He's got abdominal pain, so we've bound his pelvis as well.
It's 10 miles to the nearest major trauma centre in Hull. In less than 5 minutes, Lee has them touching down.
Ready, steady, move.
All right, Jack, you're OK.
It's a short drive from the landing site to the hospital, where Jack will need surgery. The swift rescue by the air ambulance has given him the best chance of saving his leg. At Air Ambulance HQ, Paramedic Gemma is the crew's dispatcher today.
Is it bleeding bad, Ted? Yes. His eye as well, his eye.
She's listening to a 999 call from the worried wife of a badly hurt man.
Is it his home address? He said it's his head injury. Yeah. Okay, has he got any difficulty breathing? Yeah. Are you able to go to him? Not at the moment, no.
You might have to go on this, because I think he's still unconscious.
Been unconscious for a while, hasn't he?
Paramedics Lindsay and James are heading to the man, who's been trampled by a horse.
Engines above the flight. Flight and guarded, confirmed guarded. Doors harness is stretcher. Locked and secure front right.
Secure the back.
I'm secure front left. Autopilot engaged. Auto trim engaged.
Pilot JB is flying his medical team 43 miles to the market town of Helmsley in the North York Moors.
98 Edit.
Pass your message, 15 minutes to run over.
The field that the patient is in is not clear of horses. The patient is conscious but is vomiting now.
Yeah, if the patient's in the field with some horses, then I suppose we might have to do a slightly further away recce, might we? Yeah, because we can't go with the horses or else we end up just spicking them all over the patient, potentially. Trees on the left, trees on the right. Yeah, and there's a farm in the middle, I think it's that one. Okay. If you look out your window, Lindsay, you'll see a cluster of people in the field next to the hedge.
Oh, yeah.
The horse looks like it's kicking off a bit. Maybe just drag it away a little bit. Right, you happy for me to hedge hop? Looks good to me. Okay, going over now. Right, that'll do there. Landing on. Gotcha. Okay, we're good. Yeah.
The accidents happened at a stud farm breeding racehorses. A doctor from the local mountain rescue team has been treating the patient.
This is Michael. He's been kicked in the left side of his head, just above the eye. Nasty gash there.
Yeah.
His GCS is 13, but he is really disoriented. Doesn't know his date of birth.
Okay.
Doesn't know where he is. Doesn't know today's date.
Hello, my name's Lindsay. What could I call you?
Call me Mike.
Mike. Nice to meet you, Mike. So, Mike, can you tell me what happened?
Not really, no.
He's a bit disorientated, but he's talking to us.
So his laceration's kind of to the upper eyelid, but there's no, the eyeballs seem to be intact and he's looking quite fine. The pupils are equal and reactive.
65-year-old Mike Wood is the stud manager. He was working when a spooked mare knocked him to the ground and trampled on his head.
So, Mike, do you have any pain anywhere?
A little bit stiff in the neck.
Whereabouts in the neck?
Yeah, in the head, on the right-hand side.
On the right-hand side. Okay. Sorry, I'm going to have a little squidge, I'm afraid. If it gets too painful, just let me know. If you can clench your teeth for me, is there any pain? Does that all feel all right? Good. Can you open your mouth nice and wide for me? Lovely. Any pain when you do that?
A little bit stiff.
A little bit stiff in the jaw.
Mike's wife Liz and daughter Georgina were close by when it happened. It's not the first time he's been injured by his horses.
Oh, this is the third time. He's got steel plates in his other side.
Has he?
Yeah.
You got previous then?
Yes.
Yeah.
Got previous.
Okay.
So I'm just going to have a little feel. So any pain when pressing?
So I was just chatting to the guys. Okay. So the horse's head's at least 16.5 hands, so 500, 550 kilos, I think.
She's a big mare. Yeah. Ironically, I've heard that about me before.
Lindsay's joking, but Mike's head has taken the weight of a half-ton horse, and she's concerned about his brain. She's doing some neurological tests.
Give me a big squeeze. Nice and tight with this one as well. That's it, come on, I can take more than that. Perfect. Injury-wise, it looks like a deep tissue laceration. It's like slightly temporal, but it's not bleeding at the moment. Yeah. So you can see it's just kind of where the eyeball and the eyelids meet, but it's just... He's like, yeah, his head's up and he can move it around and stuff.
Mike's had a loss of consciousness and vomiting, all worrying signs of a serious head injury. Lindsay and James want to get him straight for scans.
He is closer to James Cook anyway, so it makes sense for him to go there, doesn't it?
They're going to fly Mike to the major trauma centre in Middlesbrough. Time is critical when treating head injuries. Going by air will save 40 crucial minutes.
No, right, Mike, I'm just going to bring you gently towards me, OK? Are you all right just supporting his legs? Lovely.
Hello, it's we've got a patient I'm bringing to you. I've got a 65-year-old male who's kind of fallen over and then a horse has stepped back onto his face.
Do you know where you are at the minute, Mike?
Somewhere in Helmsley.
Okay, no worries. Do you know what date it is today?
No idea.
No, and do you know? That's absolutely fine, no problem. So we're just going to cover your face up for a minute, Mike, okay? That's it.
And I've got a beautiful wife and 3 lovely daughters.
Oh, that's nice. He says, I've got a beautiful wife and 3 lovely daughters. Good shout, Mike. Well done. You've earned some brownie points there, my friend.
Still good there.
Yeah. Bit of a lift and a slide, and just kind of where that smiley face is, we want his face.
We're giving you some paracetamol for your vein, so that's going to help with your pain. And then we're going to give you an antibiotic as well.
Radio's on light.
Got James Cook in the box, and we've got 185, which is T-side. All good.
Autopilot.
Engaged.
Auto trim.
Engaged.
Risers down.
Gonna move forward, just go from here.
Roger. You are clear.
Left. Into the hauler. Just gonna go up and back from here.
Roger.
Left turn now.
DS98, we've lifted from scene and routed to James Cook. JB, you happy for me to undo my belt a minute?
I am indeed.
Thank you.
Lindsay's giving Mike lidocaine, an anaesthetic to help with his pain.
Right, got the hospital in sight. Gonna descend now.
Slowed it down a little bit, just took a deep breath. You're like I feel a bit sick breath. So I've just slowed it down a bit.
Lindsay, you okay to strap in now?
He's giving me a squeeze. He's alright.
Bit of a left turn coming on now.
I'm secure.
Thank you. Right, that's us looking good there. Forward and down now for the pad. It'll be a little bit bumpy, but it's been bumpy all day, so no drama. Locked. Down.
Beautiful.
Idle.
You're here. How are you feeling?
Bit tired, Lily.
Bit sickish. All right, my friend. Get some fresh air blowing on you now, all right. On slide, ready, steady. Slide. Thank you, and then just rest there. Okay.
Mike is very pale and he's deteriorating. But he's in the right place now. He's heading for scans to assess the damage to his head and brain. He may be in surgery tonight. Yorkshire's rugged forests make for some of the UK's most challenging mountain biking terrain, but many of the best trails are a long way from rescue.
He's falling from his bicycle.
Uh-huh.
Okay. And what's he injured?
Collarbone.
Today, a mountain biker's day out has ended in agony.
Hello, chocolate.
Hi Gemma, can I give you a little job please?
Job.
It's a mountain biker up at Great Ayton, shoulder and rib injuries with difficulty breathing.
Dispatcher Mikey is scrambling the crew at RAF Topcliffe in North Yorkshire.
Good left. Harvard 9-8 Alpha lifting, departing to the north and east.
LA98, lifted.
Rog.
Clear area I've got.
Few birds.
Paramedics Andy and Gemma are flying 22 miles to the edge of the North York Moors. The injured biker has fallen at a jump on a remote wooded trail.
I've been mountain biking 20 years. I know the speeds involved and the chances of injury are really, really high due to the sport that we do because we love it. So when I'm called to a mountain biking accident, I know that it can be pretty serious.
There's mountain rescues been allocated.
All right.
They said that they've activated mountain rescue, so judging from that, I suspect he's quite a distance from the road or anywhere where an ambulance could get to him. So we're going to go and see if we can give him a hand. Any kind of rib injury kind of concerns us a little bit because you can damage your lungs and have quite nasty injuries from it.
Down there it is.
Got him.
Yeah.
Got him, Gemma, down in 9 o'clock.
In the orange top.
Alright, got him.
Well, that could be a bit dusty. I don't think we're going to land there. Yeah, bottom somewhere. Right, ground's a bit high there because of the track stuff, so.
Pilot Owen is landing the team close to a dirt track leading into the woods.
Oh, flatten's out down there a little bit, so I'll just put a little dip here.
Yeah.
Right, 1 skid, 2 skids. That feels okay, doesn't it? That'll do.
Not a decent is here now.
Oh, good.
Gemma and Andy will have to get to the patient on foot.
We're not going to get over this, are we?
No. Do you want to pass me a bag over then? I'll go over this bit here.
No, you can pull that bit down, look. Leave ID for him.
The local mountain rescue team are just arriving.
Hey, up, you're right. That was perfect timing.
Good timing, man.
You got it?
All right, fella. Hello, mate.
Hello.
All arrived at once.
Hey up, mate, you all right? Hey, desk 98. Yeah, we're just in the DCA. Oh, I think actually he's just walking towards us now. He's on his feet, looks like he's got a clavicle, like you said, but we'll keep you updated. Hey up, buddy. I'm guessing you're for us. Jump on board, mate. We'll get you comfortable and get you sorted out. What do we call you?
Kenny Gresham has staggered half a mile to the ambulance. He's in a lot of pain.
Sorry, I'm struggling.
It's all right.
It's all right. Have a sit there, mate. Get your bum right into that.
Get yourself comfy on there.
All right.
Oh. What have you done?
Collarbone.
Collarbone. Anywhere else?
It might be ribs as well.
All right. Did you knock yourself out or all? No. You remember everything that happened?
Yeah.
Okay.
I'm gonna cut your top off, mate.
We'll just have a cut through there just so we can have a see what you've done. I've come off my bike quite a few times over the years. I know it hurts and I know you can get really serious injuries from it. So I was surprised when this gentleman was walking towards us, but I could also tell that he was quite seriously injured.
It's the ribs that are hurting.
It's your ribs that are hurting?
Yeah.
41-year-old Kenny, a ground maintenance worker, is struggling to breathe. He was mountain biking with his son when a jump went wrong.
We can give you some pain relief. It means putting a little needle in the back of your hand or your arm.
Are you allergic to anything? No. No.
Tell you what, mate, I'll take it all.
Are you all right me using them?
Any pain across your back?
It's just, I really can't breathe that tight.
It's all right. We're going to have a listen to you. Any pain down your neck where I'm touching? There where I touch?
Yeah, it's right across there when you first touched it. There. I turned right across that side.
OK. Anything further down?
Kenny was thrown over the handlebars and landed on his head. Gemma is checking for signs of a spinal injury.
I just want to have a quick look at your ribs if that's all right, but I don't want you to move her out like that. Is it just sore everywhere?
It's not going to be all sats, bro, mate.
We're going to get a needle in your arm, buddy, and then give you some pain relief. Is that all right?
Yeah. Just get her arm nice and straight.
They're giving him morphine.
You've got some kind of central back pain, which was a little bit tender when we touched it. So if that happened and you didn't have any other pain, we'd lay you flat and block you. But you've stood up and you've walked down here, so you're moving your neck around, so I'm kind of OK about that. And I think if we laid you down flat, that's going to make that chest pain worse.
Give insert, yep, sure, mate. You've probably done some ribs of some sort, yeah. You know what I mean, but he needs the X-ray machine to look at that.
Are you guys happy to transport?
Kenny will travel 6 miles by road ambulance to the nearest major trauma centre in Middlesbrough, freeing up the air ambulance for other emergencies.
Kenny, nice to meet you, mate. I'm glad we weren't required. All right, guys, have a nice day. See you later. Yeah, so Kenny's gone off a jump on his bike and landed badly, basically. He's gone over his front wheel, thrown over the bars and landed on his left side. So basically he snapped his collarbone, his clavicle and perhaps even a few ribs. So obviously quite a bit of discomfort. That's a really painful injury, but he'd got himself up and walked down to us, which was really good from our point of view. We've given him some pain relief with the help of the ambulance crew and now he's going off to hospital.
It will be a bumpy but short journey to hospital for Kenny. He's heading to A&E for scans. He will be weeks in recovery.
Hi Dave, it's James. I was just wondering if you'd managed to find the patient, mate.
At Air Ambulance headquarters, dispatcher James is on the phone to a colleague.
We haven't got a clue where they are. We're going to get to the river and, well, we'll have to guess which way we go.
He's an ambulance responder in North Yorkshire and struggling to find a patient.
All right, mate, no worries, that's fine. I'll have a word with Topcliffe, mate, and I'll see if I can get him out to come help you, Dave.
In some cases, finding patients from the sky is their best hope. It's another case for the Topcliffe crew.
Check your front right. First go in the rear.
Clear left.
Pilot Collins soon has paramedics Andy and Sam airborne.
It sounds like patients in a quite difficult to reach location. They've walked quite some distance but still haven't found them. We're a bit worried because this patient, it sounds like they've got an ankle fracture, which could be quite a significant injury. If you get a bone infection which is untreated and hangs around for too long, you end up amputating the leg.
9-8,
9-8 receiving.
I just spoke to David, you were lifting guys, and they're still having loads of trouble finding this patient. They don't have a clue where they are.
Has anyone told you what they're wearing or what we're looking for?
I'll call back and see what I can find out.
Sort of 3 o'clock low, there's someone waiting in the corner of the field.
You see it, Colin?
3 o'clock now?
Yeah. The caller and the patient, because collar's wearing brown t-shirt and chinos. The patient's wearing a black top and green trousers.
Yeah, mate, we're visual with the patient now.
Got the tray, mate. Got the wires.
You are clear left.
Okay, well down.
9-8, we've landed.
Their patient was out for a walk when she fell.
Hi, I'm Sam. What's your name?
Christine.
Hi, Christine. So what's happened?
I went down there actually thinking this looks really muddy, and then I did hear something. I heard a kind of click. It just feels very, very weird, and I didn't want to put any weight on it at all.
Grant, have you tried to move it from there at all?
I did see what it was like standing on it, but then I didn't want to put any full weight on it.
And whereabouts in your ankle does it hurt?
It's just where it's joining. It just doesn't feel right.
51-year-old Christine Moore was walking alone, but luckily her husband was able to find her.
I just got a text saying that she'd fallen over. Got here on my son's bike as quick as I could, and that's when the air ambulance arrived.
Responder Dave has tracked them down.
Hey Dave, you all right, mate?
Yeah, that's exactly what I did. He's coming down.
So what we'll do, we'll get some gas and air. I don't know, have you used it before? If you have any babies, you might have done. So we'll use that, we'll give you some of that, and then we'll just lift your leg up and we can lay it sort of straight into a splint. Looking at it, she'll need to go probably to York, so it's probably going to be easier just to go to York rather than relocate.
Yeah, all right, mate, yeah.
It's well off the beaten track, isn't it?
Christine's leg needs to be put in a splint to ensure she's getting ample blood supply to her foot.
Nice big breaths, take as many big deep breaths as you can.
But it's painful.
It's sore.
Ooh, yeah.
There.
Yeah.
Okay. Give your toes a wiggle for me. Cool, just pull up against my finger and push down against it. That's grand. Does that feel any better with the splint on?
Yeah, you're allowed to say no.
I think what you've probably done is broken it just above your ankle. It feels there's an obvious kind of dent in it, and it was sore when I was pressing.
Yeah.
So we'll get a scoop stretcher. We'll pop you on that. We'll pop a little cannula into your arm just to give you some stronger painkillers, and then we'll get you up there and we'll take you to York.
Thank you very much.
The ground ambulance is a long walk away. The helicopter will save Christine a very uncomfortable journey.
Hi mate, yeah, I think she's got an isolated, closed, neurovascularly intact left tib-fib fracture. So, and just sort of where we are, my plan was to stick her in the aircraft and fly her to Bootham Park for York.
I'll give you a little bit of morphine, and it'll just help, because we're bumping over here and getting you into the aircraft, it might just set off a little bit of pain, so it'll just make you that little bit more comfortable.
Christine is only 2 miles from home. She does this route most Sundays, but it'll be some time before she'll be able to go for a country walk again.
I've got your leg. Just relax back.
I'm just going to have to move this slightly. Here we go.
1, 2, 3.
If the blood supply in Christine's foot has been compromised, she could face long-lasting effects. She needs hospital care quickly.
That's minute 2. Yeah, James, we'll be about 10 minutes to York.
Are you a bit warmer?
I feel warm enough, thank you.
Okay, super.
Yeah, we'll clear there, lift it, clear left.
Go over right slightly.
Tails clear that side. Air dash from 9-8, we've lifted, heading to York.
If you have a patient that's got any kind of fracture, particularly a lower leg fracture, it's always useful to feel for the pulses below the level of the injury, because that will give the surgeons in the hospital and the teams in the hospital an idea of how long that area of tissue has been without a blood supply. Hopefully she should make a pretty good recovery from an injury like this, but there's always the risk that you get a situation where the two ends of the bones don't join up very well, so you'll end up with kind of a long-term weakness there. But she should make a good recovery from this.
Yeah, the wind is still southerly, so I'll do a right-hand orbit to land. Roger. Got the mister, got the mass. That's 400 feet. There's our transport. Slowing it down. I'm going to go lengthways, mate, just because there's more high chance. Yep. Wind's going to be from the right. We'll just pop it here, shall we?
Edison 98, we've landed, John.
Right, Christine, we'll pop this off and then we'll get you onto the ambulance stretcher.
Christine will be driven the short distance to York Hospital by road ambulance.
Ready to go when you are.
Thank you.
she is heading for surgery. A serious fracture like this will take months of careful recovery.
Come on, Stu, mate.
Stuart Sanderson was in a coma for 11 days. After falling off his sports bike, he suffered a bleed on the brain.
If he's looking difficult, I'll give him a bit of ketamine.
He broke his back, punctured his lung, and is still having physiotherapy. He's been told it will take 2 years to recover from his brain injury, but he's improving each day.
Are you able to wiggle your toes, Jack?
Doctors found farmer Jack Clappison had 7 major blood vessels in his leg after being attacked by one of his cows.
The cow just looked at me and come straight for me and just knocked me straight in the sky. And my right foot was above my left shoulder. The only thing I remember is this helicopter flying above me and I was holding my cap on. And that's the last thing I remember. I laid in this bed in hospital next thing I knew. Come on then, come on, come on then, come on.
Jack needed surgery to repair the blood vessels and ruptured ligaments in his knee. He spent 7 weeks in hospital and is recovering slowly, although his mobility will be permanently affected.
Touch wood, my foot is going clearly again, but it's swollen up, somewhat rotten. I was in a wheelchair for maybe a fortnight, 3 weeks, something like that, in a wheelchair. And then I got a little electric buggy. I take the dog down the road for a run with the dog with me. Come on then, come on.
He's back working on the farm now.
I've improved and I thoroughly enjoy coming up to look around the cattle and feed them and everything. It saved my life, that's what I think. It was wonderful to come. If it hadn't been for David, I think I've had my leg off, I think. It's the ribs that are hurting.
It's your ribs that are hurting.
Scans confirmed mountain biker Kenny Gresham broke his collarbone and 3 ribs when he went over the handlebars on a trail jump. Doctors plated the collarbone and reinflated his punctured lung. Kenny's riding confidence has taken a bit of a knock, but he's now back on his bike.
Whereabouts in your ankle does it hurt?
It's just where it's joining, it just doesn't feel right.
Surgeons pinned Christine Moore's badly broken ankle after she slipped and fell on a Sunday morning walk near her home. Christine spent 3 days in hospital, but it was 4 months before she could return to her job as a primary school teaching assistant.
He's been kicked in the left side of his head, just above the eye.
Eye specialists in hospital found racehorse stud manager Mike Wood remarkably avoided fracturing his skull and eye socket when a half-ton horse knocked him to the ground and stood on his face.
Eyeball seems to be intact.
Mike spent 3 days in hospital and needed stitches for lacerations to his face. Mike is fully recovered. He still looks after the mare who injured him.